Okay, to set up my room, I bring my cassette in, set my cassette in the table bucky. I line up my tube in my bucky.
What you do? Practicing?
Once my table and my bucky are lined up, I set my distance to 40. Okay, to set up my room, I come to my console and I select the tabletop. I turn off my AEC. I select my knee and I increase my KVP to 66 and set my mass at 6.3. My name is Fran. Thanks, Rick. Can you tell me your first name and date of birth?
Tony Bodine, and it's 11/20/1965.
Dr. Smith has ordered a knee X-ray for you.
Yeah.
How did you injure yourself?
Running. She got my drip and I felt it pop, so it's been hurting ever since.
Okay.
Yeah.
I will need you to change into a gown and just remove your slacks, and we'll give you the gown to try on.
Okay.
And then I'll pick you up and take you back to the room.
Okay.
And we'll start with your explanation. You can go ahead and turn around and lie back if you like. And it is your right knee.
Yes. All right.
So I'll go ahead and place the cassette in the bucky. Move the table to 40 inches. And center the light over the knee, ½ inch below the patella. Place my right marker on the bed right next to the patient's stomach. I'm going to colocate my light in, 1 inch around, all the way around the knee. And then I want to shield the patient. For my internal oblique knee, I set my bucky to the tabletop, selected my knee, turned off my AEC, set my KV for 66, and reduced my mass to 6.3. So now for the internal oblique, change out my cassette. I'll be centering at the same position, ½ inch below the patella. And I'm going to have the patient rotate his leg in 45 degrees. Maintaining the same elevation. Okay, sir, just hold real still, like take your X-ray.
Okay.
For my tunnel view on my knee, I selected tabletop bucky, selected the knee, turned off my AEC, set my KV to 70, and reduced my mass to 6.3. Okay, Mr. Hogan, now we're going to do the tunnel view of your knee, so let me switch out my headsets. And this one I'll need you to bend your leg up for me. I'm going to angle my tube perpendicular to your tibia. And then I need to line up the set. And back. I need to line up your knee to half inch below. Okay, very good. Hold still. For my lateral knee, I set my Bucky to the tabletop, selected my knee, turned off my AEC, set my KV to 66, and my mass to 6.3. Okay, Mr. Hoagie, now we're going to do the lateral view of your knee. I just need you to roll over onto your side.
Okay.
And I just need you to bend your leg a little bit. There you go. I've got my foot back. In the center on the condyles of your knee here. So, okay, there you go. Hold go still. For my sunrise knee, I selected tabletop Bucky, selected the knee, turned off my AEC, set my KV at 70, and my mass at 6.3. Okay, Mr. Hoagie, now we're going to do the final image. I just need you to roll over onto your stomach. I'm going to put you in the front position. And then I need you to pull to lift your right leg up as far back as you can comfortably. I'm going to angle my tube 12 degrees. And I'm going to center my patellofemoral joint. Hold real still. Okay, so when I get my requisition for the patient's x-ray, I come to my computer console and I register the patient. Put in their name, date of birth. Their ID number, and hit next. I'll select my my imaging to be done on my knee, my internal oblique, my lateral, my sunrise, and my tunnel. And then I will start my study. Okay, after I've taken my x-ray, I come back to the computer and scan my cassette and then place it in the reader to be read, and then I continue on with the rest of my exams. Okay, the criteria for a good knee x-ray include on an EP image. The femoral tibial joint space should be open. The head of the fibula will be slightly overlapped by the proximal tibia. The patella should be completely superimposed over the femur. And in a normal knee joint, the femoral tibial joint space should be equal on both sides. Okay, on an internal oblique, the tibia and fibula should be separated at their proximal articulation. The lateral condyles of the femur and tibia should be visualized. The knee joint should be open. Both tibial plateaus should be visualized, and the medial margin of the patella should be projected slightly beyond the medial margin of the femur. Okay, on a lateral knee x-ray, the femoral condyle should be superimposed. The patella should be projected in profile. The femoral patellar space should be open, and the fibular head and the tibia should be slightly superimposed. Okay, on the tunnel view, the fossa should be open and visualized. The apex of the patella should not be projected into the fossa. The posterior surface of the femoral condyle should be visualized, and the legs should not be rotated as evidenced by slight overlap of the proximal tibia and fibula. Okay, in the sunrise view of the patella, and the patellofemoral interspace should be open, the patella should be seen in profile, and the femoral condyles should be visualized.